Hi there, and welcome to this video on the dentistry interview, focusing on the third GDC principle of obtaining consent. I'm Alice from Dentist Mind, where we go through the important topics of the dentistry interviews. Whichever university you're applying for, MMI or panel, we've got you covered. If you're new here, be sure to click that subscribe button. Whilst you're watching, please leave any comments below if you're unsure about anything. We've got helpful timestamps below for each part of the video to help guide you. The following video is a free sample of our full interview course, which you can buy by clicking on the link below in the description. So let's get started. Welcome to lesson 6 of dentistry ethics. This time we're looking at the third GDC principle of obtaining consent. So the principle of obtaining valid consent is broken down into these categories. The first of these is to obtain valid consent by ensuring all information regarding the treatment and the costs is given to the patient. If the patient isn't fully informed about all of these things, then the consent will not be valid. So, for example, telling the patient about the possible complications of the treatment and other treatments that might be necessary if this one fails, as well as the costs associated with all of these, is necessary to obtain this valid consent. The next point it's broken down into is making sure the patient understands the decision that they're making. So a way that this could be done is if the dentist asks the patient to say it back to them in their own words to prove that they understand what they're signing when they sign this consent form. And the third point it's broken down into is ensuring that the patient's consent remains valid at all stages of the treatment. So it is totally in a patient's right, as long as they're competent, to make the decision to withdraw consent at any stage. So you could be halfway through doing a filling and the patient decides they don't want to. And if the patient withdraws their consent, it is therefore no longer the dentist's ability to continue, because this would be breaking the law. So it's important the dentist checks with the patient at every single stage that they're still consenting to the treatment that they're being given. So on this slide, we have a Practise MMI station for you. In this situation, in an interview, you might be given 1 minute to read the scenario and then 5 minutes to discuss it with an interviewer. So in this scenario, we have the 6-year-old girl and her father, and the 6-year-old girl is being advised that several teeth should be extracted. Well, the father's refusing this, so take some time now, pause the video, read through it and think about your answer, maybe practice saying it out loud about what you would say if you got given this scenario in one of your interviews. So on this slide, we have a few things which you could include in your answer if you didn't already. The first thing to do would be to address the father's concerns. So ask him why it is he doesn't want his daughter's teeth extracted, and therefore you can get to the bottom of the issue maybe, and hopefully explain to him why it is best for the patient. So explaining why it's best for the patient is really important, because this is incorporating the principle of beneficence from the 4 medical pillars. It's because you're trying to do good for the patient and do what's in their best interest. Other things to mention in the answer would be about competence. So a patient can only consent to a treatment if they're competent to make this decision. As a child, it is automatically assumed that they're not competent, and therefore a parent or guardian needs to sign the consent for them. However, if a child is deemed competent enough to make this decision, they can be granted Gillick competency, which means that they can sign for themselves. Despite this, a 6-year-old is unlikely to be Gillick competent, so in this situation you've been given, you probably do need to obtain the consent from the father. Another thing to mention is autonomy, about how it is in the patient's right to make this decision. So if they decide they don't want the treatment, then it is in their right to do this as well. So that was lesson 6, and it's now complete. Hopefully this has given you some more information about obtaining consent and the kind of things to say if you get a scenario about this in your interviews. If you like this video, make sure to subscribe by clicking below, and please leave a comment. Click here to continue watching our interview series, and to unlock full access to 70 tutorials covering core interview topics, MMI mocks, top tips and more, click on the link in the description below.